So how do you trace the bronchial arteries? Bronchial artery comes to the bronchus, supplying the good blood. So bronchial artery is a branch of. Anyway, I want the chocolates from you. I can ask anything. I'll make you say I don't know. Nusrat, are you there? Hello? Hello? Nusrat? Can you talk? Say yes or no. Are you there?
I think her internet has gone because of the question.
Sorry,
Oh.
no, I am there. Sorry, I was speaking. It arises from thoracic aorta. Bronchial arteries arise from thoracic aorta.
Oh, you took time to Google. I know. Yeah.
No, sir. I was
See?
speaking. I kept my mic off.
Okay. You're right. So, what will happen to bronchial artery? It comes and supplies. Okay. Now, what is the bronchial vein? Where the bronchial vein arises from and goes and empties where?
Empties directly into vena cava.
Directly into vena cava.
Superior.
Then it will go into the right side, right? Anybody can answer. No, I won the chocolate because Nusrat is wrong.
Okay, sir. Okay.
Any answer? Anyone can type. Okay. Bronchial arteries, as Nusrat rightly said, is a branch of aorta. It comes and supplies the bronchi. And where does it drain into? Bronchial veins. Where do they drain into?
Someone has said no bronchial veins.
No bronchial veins. No bronchial veins. So where does the blood go? Then bronchial artery supplies bronchi.
Pulmonary vein itself.
Huh?
Pulmonary vein.
Pulmonary veins. Who said that? Pulmonary veins? Pulmonary vein. Okay. Hafsa. Okay. It drains directly into the left atrium. Directly. Unpurified. That is very important. All the blood that comes, very important. All of you, please listen carefully. Listen carefully. All the blood from the entire body comes to the right ventricle, and from there it goes into the lungs. They get purified, oxygenated. And this oxygenated blood comes back into the left atrium, left ventricle, and then to periphery. But only one artery that empties directly into the left atrium without getting purified. So venous blood gets mixed in the left atrium. That's why when you check your oxygen levels, they're not always 100%. They're anything between 90 and 100, you take it as normal. Even if your saturation is 90, it is normal. So this is the reason. So our blood, the pure blood that comes back from the lungs to the left atrium and left ventricle is not 100% pure, because only one vein that enters and then empties directly without getting oxygenated is your bronchial artery. In spite of that, nothing happens. So that is so Nusrat, anyway, good, congrats, you answered the majority of the most of the part of the question. Anyway, so like the lungs, liver also has dual blood supply. 20%, as somebody rightly typed, 20% from the hepatic artery, and hepatic artery is a branch of, you can type again. Arbaz?
Celiac trunk.
Celiac trunk is the right answer. Lubna from Deccan. Yeah, Lubna answered right. It's a celiac trunk. It's a branch of celiac trunk. So it is hepatic artery that supplies the 20 to 25% of the blood to the liver, and remaining is supplied by the portal venous system. Portal vein. Portal vein drains from the entire splanchnic circulation. Entire splanchnic circulation, that intestines, everything. So the hepatic artery supplies oxygen to the liver, and portal circulation supplies the nutrients that are absorbed from the intestine from the food that we eat. So liver receives two blood supplies. One is oxygenated blood, one is venous blood in the form of portal vein with full of nutrients and for the metabolism in the liver. So that is the blood supply. So how to divide the liver? How many lobes do you have in the liver? 2 lobes, right and left, divided by falciparum ligament. Falciparum ligament. Okay, but this is this is only anatomical division, but you can functionally divide into 2 parts, right hemi liver and left hemi liver. You can divide into 2, and surgical anatomy wise, there are some 8 segments, 2 lobes and 8 segments. Each segmental division is very important, because each segment is supplied by one hepatic artery, branch of one hepatic artery, branch of one portal vein. Each segment. That's why it is very important clinically, surgically, and even radiologically. Radiologically, it is very important. Suppose something happens to one particular segment, that means if that particular artery is blocked or something happens there, you can surgically remove that part of segment. And same thing if you are transplanting somebody's liver, we don't transplant the entire liver. I don't know how many people know this. If somebody requires liver transplant, we don't transplant the entire liver. If you transplant 1 or 2 segments also, it is okay. The liver will grow like a round. It doesn't get back into the same liver shape, but it will grow to as big as the liver, sometimes even more. So the liver has got an enormous regeneration capacity. So that is roughly about what is the functional unit of the liver? Hepatocyte. Hepatocyte is the liver contains 80% of the liver cells are hepatocytes. 20% are Kupffer cells and all those connective tissue and vascular tissue, little bit of fat, all those tissue. 80% are hepatocytes. That is a functional unit. Hepatocyte has enormous capacity to function. Like, what are the coming to functions of the liver? What are the functions of the liver? Detoxification. From Zishan Sheikh. Synthetic, yes. Hafsa, what? Metabolism, very good. Synthesis, metabolism, glycolysis, glycogenolysis, neoglycogenesis, glycogenolysis, and storage of B12. Excellent, Nusrat. Keep on typing. Go on. Storage of glycogen. Majid, very good.